Triodent is happy to introduce Triotray, the superior posterior impression tray. This single-use metal dual-arch tray is customizable to fit almost any mouth with a high degree of impression accuracy. Triotray comes in left and right versions, with the lingual tabs angled more vertically than the others in order to keep the tongue in a passive position where it cannot interfere with the impression. The side tabs are plastic-coated for extra patient comfort. Because the Triotray can be customized, it's important to try it in the patient's mouth first. Place the tray on the arch and ask the patient to close in centric occlusion evenly and on both sides, and check for side tabs impinging on tissue. Ask the patient to make sure their tongue is not under the side tabs, where it may exert pressure and distort the impression. The side tabs can be adjusted to allow for mandibular buccal plates, lingual tori, and shallow palates. If the tray impinges on the soft tissues, use your fingers or pliers to bend the side tabs out of the way until they are next to the opposite tabs if necessary. If there are no impingements, you may also bend the tabs inward for a tighter fit. This can save considerably on impression material. Coat the tray mesh with adhesive. This is especially recommended if you're using the putty and wash technique or if you're concerned about stone binding an exposed mesh during casting. Place some impression material on the abutment tooth. Now load the Triotray with a generous amount of impression material, especially towards the back. Ensure there is sufficient material to flow between the side tabs and ultimately set around the tabs. Being too sparing with impression material at this point may cause casting problems later. Place the loaded tray on the arch again. Now get them to bite as before. Ask the patient to move their tongue away from the impression tray. Once the impression material has set, use your fingers to lift the impression off the teeth. Do not use the Triotray handle. If any side tab tips are exposed or there are undercuts, ask the lab to put wax on them before casting. The technician should then have no difficulty making multiple models. When the crown comes back, you will appreciate just how accurate that Triotray impression was.